Welcome back. Thanks for joining us this morning. Well, we've heard a lot of new terms in 2020, and one of those terms is COVID long haulers, people who experience symptoms months after contracting the virus. Now, new research being done out of UBC is hoping to find solutions to this problem. And joining us now is one of the leading researchers on the study, Dr. Fuchsia Howard. Thank you so much for joining us this morning.
Good morning, Mary. It's a pleasure to be here. Thank you.
So your research targets COVID patients who were in the ICU, now in critical need of long-term support. And a lot of that support, according to your research, is lacking in Canada's healthcare system, which is very concerning. What kind of support do these patients need right now to survive?
Yeah, well, so people who have been critically ill and are treated in an ICU, including COVID patients, they really need access to both clinicians and therapies that address the significant and ongoing health challenges they experience. So we know that more than half of critical illness survivors actually suffer from an ongoing constellation of health problems, and these include physical impairment, cognitive impairment, and mental health challenges. So you can imagine someone who's been in an ICU and on a ventilator and in a bed, they may continue to experience shortness of breath, they may have extreme muscle weakness, and they really have trouble functioning in their daily lives. Many patients also experience trouble with their memory, their attention, and their ability to think. And lastly, while people are in the ICU, they can have delusions, hallucinations, and nightmares, and they've been through a very traumatic experience. So you can imagine that afterwards, many people experience anxiety, depression, and symptoms of what we call post-traumatic stress disorder. And actually, the rates of what we call PTSD in ICU survivors rivals those of soldiers who are returning from combat. So if you consider all of these health challenges, people really need formal support and recovery programs that let people know what to expect when they get home, but it also keeps them connected to healthcare providers that can help them. I mean, one of the things we know from ICU survivors in general is that about half of them will actually end up back in the hospital within the first year after leaving.
That's incredible.
So,
yeah, I was going to ask you about what are some of those symptoms, because we know the list of COVID-19 symptoms just keeps getting longer and longer and longer. So you're saying muscle fatigueness, memory loss, PTSD from being in the hospital. So based on your research so far, Dr. Howard, what can Canada's healthcare system do right now to make sure that these patients are receiving the best care and the best quality of life?
Yeah, what we do need to do is fund comprehensive research-informed clinical programs. And these need to be research-based because we actually don't yet know how best to treat this post-intensive care syndrome. And so making this a reality will require the medical community to come together. There are expertise across the country. We just need to come together to figure out a plan. We also very much need the amplification of the voices of patients and family members because we don't yet fully understand what people want and need. And lastly, what we really need is the support of senior healthcare leaders. And so I'm quite optimistic, actually, that COVID could represent a turning point in ICU survivorship, such that people who require life-sustaining intervention not only survive, but then actually eventually go on to thrive and have meaningful lives later on.
Well, it's very encouraging to hear your optimism there, Dr. Howard. One more question for you. We know COVID-19 has spread all over the world. Are there any healthcare systems globally that have, adapted these new systems to help these patients?
Yeah, and in fact, in places where there have been high numbers of COVID patients in their ICUs, and they had pre-existing ICU recovery programs, they have very much adapted to also follow COVID survivors. And so there's been a scaling up of these critical illness recovery programs. There's excellent examples in the United States, out of Vanderbilt, Nashville, and also Johns Hopkins in Baltimore. The other aspect that we've seen great strides in is virtual care. And so in the UK, for example, they've launched an online rehabilitation service. Similarly, in the U.S., there are peer and professional-led support groups that are meant to address some of the mental health challenges that people are experiencing.
All right, Dr. Howard, I'm so happy we were able to have you on the program this morning. Thanks so much for joining us.
It's been a pleasure. Thank you, Mary.
All right, that is Dr. Fuchsia Howard joining us from UBC's leading research study on how to treat post-ICU COVID patients. It is 8:20.